Hi everybody, my name is Dr. Brian Raid and I'm a naturopathic doctor, and this is a video about treating complicated cases of yeast overgrowth syndrome. I posted my last video was about treating uncomplicated cases, and not to say that they can't be impactful, but just that they cases that aren't really complicated by other things that might be going on beyond just the yeast overgrowth itself. So this video and the last one were inspired by a question that somebody had posted on one of my, or a comment that somebody had made on one of my previous videos about yeast, about how long does it take to get better from a yeast overgrowth, or what kind of, there was that question too. It was a question about what kind of interventions can be helpful. And so the long and short of it with the more complicated cases is that the same types of treatment angles or approaches that might be used to treat uncomplicated cases that I mentioned in the last video, certainly I would still use to work with patients who are dealing with more, who have complicated cases that involve yeast. But the big difference is that it's also important to, to make sure that we're treating the other factors that might be driving that yeast overgrowth in the first place. So for example, if there's small intestine bacterial overgrowth, also known as SIBO or SIBO, then that might need to be addressed to some extent, if not fully, before the yeast is going to fully respond. Also in the more complicated cases, or especially the more chronic cases, there might be more of a biofilm component predisposition with the yeast. And I've had a number of patients to date where they've come to see me saying, I've worked with Dr. So-and-so and my yeast symptoms are so much better, but whenever I start to back off on my diet a bit, or I start to back off on the antimicrobial herbs, or sometimes medications, most people aren't on long-term fluconazole and nystatin and things like that, but if they're saying, I just can't seem to get off my oil of oregano, or I can't seem to get off of my berberine, or I can't get off of my black walnut wormwood combo tincture, or what have you, otherwise my symptoms flare back up again. What I found is that in a lot of those cases, we've needed to go after biofilms. What I've also found is that in some of those cases, we need to look at things through a totally different lens, and looking at it through the lens of, this isn't just a yeast overgrowth, this is a yeast hypersensitivity issue, which is something that ties into low-dose immunotherapy, or LDI for short, which I've had videos about that as well. If anybody wants me to do an updated video specifically talking about LDI for yeast hypersensitivity, I'm more than happy to do that. But the long and short of it is that there's a couple of clues, in my experience at least, that suggest that maybe we're dealing with a yeast hypersensitivity, kind of like a yeast allergy almost, as opposed to a yeast overgrowth necessarily. And sometimes both things are going on. But when patients come in saying, if I start backing off on my diet, or I back off on the herbs that are keeping the yeast at bay, it takes me days to, or maybe weeks before I start feeling worse. I just start feeling progressively worse. A case like that would more strongly suggest that we might be dealing with biofilms, or maybe that a big enough hammer hasn't been used to really clobber the yeast enough to get their numbers down. But more likely it's probably a biofilm thing, or it's more likely it might be a biofilm thing. If a patient says, I eat, even a little bit of sugar, or I come off of my herbs for, even like I just miss a morning dose, or I lower my dose down too much and I have symptoms almost right away, then that's more of an indication that we might be dealing with a yeast hypersensitivity issue. And the big difference there is that in scenario A, where it takes maybe days or weeks before they start feeling worse, it's that, well, you've taken the pressure off the yeast, and now they're having yeast babies, and they're, not that they actually have babies, they, so self-reproduce, so to speak, but they have more, they have time to kind of build up their numbers, and as their numbers, slowly but surely increase, then you're going to start feeling worse. Whereas the other scenario, scenario B, where you feel worse, within seconds or minutes or hours of not having enough pressure on the yeast, would suggest that there's more of a hypersensitivity, because that's all mediated through your immune system. And anyone who's ever had, a bee sting, or anyone who's ever had an allergic reaction to something, knows how quickly the immune system can be triggered. Even if you don't have allergies, somebody blows dust in your face, you're coughing and sneezing and sputtering, which is mediated through reflex pathways in your airways. But any subsequent symptoms that you might get with, tearing eyes and so on and so forth, and some of that might be mediated more through your immune system. Not the best example I've ever had. If you've ever had allergies, then you know how quickly your immune system can can react to something. And so that's similar if you're sensitive to something like yeast as well. A little more yeast starts to grow in your body, you might have a very quick reaction to that. So those are a couple of thoughts around treating more complicated cases of yeast overgrowth, and I hope that's useful.